that number is expected to rise, and one death in the parish. We would like to get the word out to please start paying attention to the stay-at-home order the governor has issued and the curfews that this parish-wide that we issued. We're going to have a couple of speakers today to try and reinforce that and to provide a little bit more information with what's going on in the parish. We'll begin with the mayor of Opelousas.
Thank you, Van. Would everyone please join with me just for a moment of silence and keeping the family of the lost one that this parish and this city lost in the last 24, 48 hours. Just a moment of silence. And again, condolences and our sympathy to that family of that lost individual. Again, to echo Mr. Van, it is adamantly and very highly important that we continue to listen to the preventive measures and the messages and the guidelines that have been given to us from the CDC and the LDH and here in the local governments also, that we stay at home and practice the social distancing that has been conveyed time and time and time again. That curve will be lowered if we do our part on the front end. And the tail end, it will not be so high. So please be compassionate. Be kind to your family, your friends, your neighbors. Understand that this battle that we are going through, it's not on me. It's not on Van. It's not on the news people that's here today. It's on all of us. And all of us have to play a part in doing our part as we continue to go forward. I'm asking all of you to join in this fight and adhere to these measures and guidelines that have been conveyed and updated every day. Citizens of Opelousas, we are still providing the type of services and giving relief at the same time. We have limited personnel that's working, and the city of Opelousas is still open for business. So the services are being rendered. We ask that you continue to come in and see us. Our office hours are still 7:30 to 5:30, and on Fridays, we close at 11:30, opening up at 7:30. In the position that I sit in a different type of leadership, because we have to lead, and the decisions that we are making is not only for ourselves, the employees who's out there every day providing the services that we are required to do, but also for the people that we represent. And our decisions every day impact you. And it's not easy. I'm not resting at night because I'm not so much worried about tomorrow. I'm worried about a month, 6 weeks down the line. Our economy, we're starting to feel the effects of that. If you're following the news medias, and the national channels, many companies are furloughing people, letting them go early on. And we do not see the end of this enemy that has no friends, young or old. We have to do better today. And if we join together in this fight that we've been fighting here for the last month and a half, it will end soon. But it's going to take a genuine, disciplined effort from all of us that are involved to do just that. I want to thank the medical field, the personnel. I know Representative Miller's here, and he's going to speak later. Thank you, Representative Miller. But all the nurses and the doctors and the first responders whose job has become so difficult here recently. Dr. Ken Cochran, the CEO of Opelousas General Hospital System, he's here today. You're the heroes here. You're the one that's fighting every day, standing up, taking care of the loved ones of many of our family members and friends who are going to the hospital and looking for the type of assistance that they need. And it's just begun. But again, it's going to be reiterated by everyone that comes up here and through the news, the national news, our leaders nationally, and to say, stay at home. Our president extended the social distancing for another 15 days to the end of April. If he's doing that nationally, what you think we should do here locally and statewide? Please, let's come together and understand that the person to the right of you and the person to the left of you, we need to join together. Become the Three Musketeers. Let's do the same thing for everybody that we're involved with. And last, how you respond to this will dictate how tomorrow will be. I'm asking you, the citizens of Opelousas, my friends beyond the boundaries of Opelousas, let's do this together. We can have a good day today, but if we follow through with the guidelines and the preventive measures that have been conveyed to us day in and day out, tomorrow will be better. God continue to bless you. Thank you all for coming today. God bless the city of Opelousas, the great state of Louisiana, and the United States and the world. Thank you. Next, coming up to speak will be Representative Dustin Miller.
Good morning, everybody. I would just like to say thanks to everyone that's working on the front line of this. Thanks to the hospital staff. Thank you to the janitor, to the cafeteria worker. It's really hard to go to bed at night thinking about that nurse, that mom and that dad who's actually having to wake up in the morning and go and be on the front line of this and return home to their family, hoping that they do not spread the virus. So we need to continue praying for all of those and praying for our medical providers who are at the front line of this virus. This virus is serious, and it's something that I've never thought I would experience in my life. The state's gonna be working closely with our parish. Dr. Ken Cochran, the CEO of Opelousas General, who will be speaking very shortly, is being very progressive and proactive of making sure we have the supplies that we can get. The state actually asked for 15,000 ventilators. I think President Trump agreed to send some. Right now, I think we received 150. So the ventilators and the PPEs are coming in, but they're coming in at a slow rate. So what we have to do is just try to be prepared here in St. Landry Parish, best prepared as we can be. Right now, the capacity, and I'll let Dr. Ken speak on this, Dr. Cochran, the capacity in our critical care beds across Acadiana is filling up. So we need to do our part, and this is serious. And when I say do your part, stay home. There's no reason to invite your family over and have family gatherings. There's no reason to be playing dominoes on the porch or something with 6 people, because they can be carrying the virus and still be asymptomatic. So just please do your part. We're going to continue to do ours, practice social distancing, try to just limit going to the grocery stores once a week. Not the whole family need to go. Please, just one person go and do what you can for the whole family so that we can limit the effect and the peak of this curve, and so we can keep it down. So I just want to thank everyone who's working good. Thank you, Van, for all of your hard work. Please, guys, please follow the curfew that's in place. It's put in place for a reason. We can do this. We will do this, and just please pray for everybody, and thank you.
Well, good afternoon, and thank everyone for coming and for watching this. My name is Ken Cochran. I'm the President and CEO for Opelousas General Health System. I'm also a trauma nurse by training, and I've been raised predominantly in a hospital for my entire life. First, I wanted to tell you and assure you that Opelousas General is here. We are more prepared today than we were a week ago, and we will be more prepared in a week than we are now. We're doing lots of things to try to be as prepared for a situation that we've really never seen before, so this is new. Wanted to assure you that yes, all the healthcare workers, not just the health system workers, but all the other healthcare workers are also waking up every day and making a choice to come do their jobs and serve the community at a time that needs us the most. I wanted to mention a little about the coronavirus and that it's a new virus. So sometimes hearing different stories and newscasts, it seems a little confusing. To ease your mind, just understand that most of the time we live off of medical information that has been vetted for years and slowly changed and updated. You're seeing raw medicine, the study of medicine, at its raw moment. So when you see a new fact every day or a new discovery by CDC, don't think that they were wrong the day before. They are just actively learning and researching as we go. St. Landry was mentioned. We have 15 confirmed cases. I'm sure at noon when the new report comes out, that number will be higher. Testing is a lot more available than it was even just a few days ago. We're doing a lot more testing at the hospital. I know the doctor's offices are as well. Just to put in perspective, over the last 7 days, we went from 3 to 15 cases. That is a 400% increase. So this spike in this curve that you hear about or seen in other areas, we are seeing. We do think, again, that number will go up. So when you see that number go up this afternoon, that is what we expect, especially as we do more testing. We've acknowledged a lot of people. I wanted to acknowledge public health. This is a public health crisis. I pray we gain a greater appreciation for the staff and leadership of the Louisiana Department of Health. These men and women work behind the scenes and play a very crucial role in helping us break the chain of transmission. So if you wouldn't mind, join me in a round of applause and appreciation for them. Opelousas General understands that community health requires more than just hospitals and government policy. Through our effort to Healthy St. Landry, which is done through our foundation under the leadership of Ms. Tracy Ante, we have created a forum to bring all the determinants of health together. This team includes law enforcement, health officials, social services, education, housing, financial planning, and many others. This is work that is how we improve community health, and it gave us the foundation to be able to communicate across multiple agencies and nonprofits and efforts during this crisis. So it's a good thing that we actually started doing that 1.5 years ago. But my point is that we have to all work together to improve community health. Hospitals, policymakers, doctors, they can't do that alone. It takes everyone. So a little bit about Opelousas General and what we're doing. Safety has been the most important thing to us. Anytime you have chaos, you have or perception of chaos or things that you don't do every day, you have a higher risk for error. So we've been trying to implement processes, monitor them, make changes to them, and make them as safe as possible. It is also important to us to make sure our staff are as safe as they can be from this virus. We have a limited number of highly trained people. They're excellent, but it doesn't take much to put us over our normal capacity. One of the biggest things we have done is we are converting our entire fourth floor into a negative pressure or isolation room space and our entire ICU into isolation. What this will do is it will help pull the air out and clean it and reduce the amount of virus particles in the air so that it would be less likely for our patients and our staff to contract. As we speak, that is our isolation space is being generated. We're actually moving from 7 isolation rooms to 41, which is nearly 6 times our normal. That will be completely completed by the end of this week. You've heard a lot about ventilators. We have twice as many ventilators as we usually have. Per the projections, it may not be enough. From a PPE or personal protection equipment, you've heard about these masks and surgical masks and N95 masks. We are also short those. We do have some. We have enough for now. And as Representative Miller mentioned, we are on the phone constantly with the state, the feds, the vendors, the suppliers to try to get as much as we can. Our pharmacy, which is known as WellSmart Health Pharmacy, added curbside pickup at the hospital as well as delivery to their services to make sure that no patient is at home without their prescription medicine. If they don't take their prescription medicine, then obviously they're going to get sick or sicker and then need to come to the hospital. In closing, we did have our first death of COVID-19, and I had also heard some criticism, didn't know it was going to be mentioned today, but I do want to mention that this first death is actually somebody's wife, mother, grandmother, daughter, and sister. Her family deserves privacy and the chance to mourn. Citizens that come into contact with known COVID-19 patients are contacted by the health department, by the hospital, or by their healthcare provider. We will report the daily numbers. We will not issue a press release out of respect for the families. One more personal stay-home message. I've already lost my 18-year-old son and my father of 42 years, stepdad of 42 years. I personally have health problems. My mother is extremely frail, and my mother-in-law, who lives with us, is extremely susceptible to COVID. This is not a game or a political statement. Please join healthcare workers in actively saving lives by staying home. Thank you.
Good morning, everyone. My name is Bill Rodier, and I'm the CEO and the Director of the SLED Economic Development Group. I'd like to share just a few messages with you this morning related to business and the impact on our communities and specific to businesses on things that you can do to be proactive. First of all, I'd like to thank our leadership for coming together like this to share a common message of how important it is to work together, Opelousas, Acadiana, Louisiana, across the board. Tomorrow's the first of the month. Many people rely on government assistance to get their groceries and fundamental things to survive. I have been to the Super Walmart here specifically in Opelousas. I've been to the Lowe's here in Opelousas. Both are open to get essential supplies. I'd like to reiterate the message that you've heard consistently. If you have to go, please, please limit the number of people that go. Too often, I see families of 3, 4, 5, and 6 people in the Lowe's, in the Super Walmart. This is going to pertain to all the grocery stores. They're going to struggle to be able to maintain the distancing that they need for their consumers to get essential supplies if people don't take the initiative on limiting the number of people that go to get those supplies. I ask you, please, for the protection of our communities, for the protection of our area, and for the protection of your families, and to continue to allow these businesses to provide these essential services, that you limit the number of people that go out to get those supplies. Everybody understands that it's necessary, but please, please, please take the precautions necessary to do that. For our business owners across the area, last Friday we all know in Washington, D.C., the CARES Act was passed. A big part of the CARES Act was targeted towards local businesses and their ability to endure what's going to be a very challenging month of April. That puts a lot of money into the Small Business Administration, the Economic Development Administration, and other resources to get down to our local businesses to help them through these challenging times, as well as help their employees through these challenging times. A few things that I'd like to point out with this. Understand that a small business, by the definition of the Small Business Administration, means 500 employees or less. If you are a business owner and 500 business employees or less, you probably fall into 90% of the businesses in our area, and I'm asking you to do this at this point in time if you're not already doing this. There are programs out there that the processes are being defined right now through the Small Business Administration. I ask you to take this time to be proactive in learning more about what those programs mean. They are federal programs. There's going to be compliance mechanisms associated with those programs. It's going to be a process to implement those programs. April is liable to be a month to where we have very limited accessibility to businesses, and the impact on the employees is going to be significant. If you are a business owner, what are some of the things that you can do right now? First of all, look at the resources that are available at opportunitystlandry.com/COVID-19 resources. Look at Opportunity Louisiana, COVID-19 resources, you can call a toll-free number, 833-457-0531. That's a number that's been set up from 8 a.m. to 8 p.m. through Louisiana Economic Development to give you information on what may or may not be suitable for you with the small business assistance that's come down from Washington, D.C. through the state as part of the CARE Act. Now is the time for you as a business owner to be proactive. If you have a relationship with a local lender that it's approved SBA lender, if you haven't started talking to them and you need assistance, now's the time to make that connection with your lender with that. Your CPAs should become and are becoming more familiar with these programs, what they mean from Washington, D.C. If you are a business owner, I would encourage you, if you haven't done that this week, to take this week to make it a priority to educate yourself on the Small Business Administration loans that are coming down through the CARE Act. So if you need them and your employees need them, you can implement them through the month of April. If your employees are impacted by this, laworks.com, unemployment assistance can be filed for online. If your employees would like to call to get unemployment information and benefit information, 866-783-5567. As you can imagine, the Workforce Commission is doing a yeoman's effort of trying to handle the overflow of calls right now. We would encourage you to encourage employees to file for those claims online whenever possible. But those are two resources for both business, 833-457-0531, and for your employees, 866-783-5567. Thank you so much again to our leadership. Thank you so much to our press that you guys are out here on the front lines. They talk about folks on the front line. You guys are out here on the front line getting these messages out. Thank you so much for putting yourself out here to do this. Thank you, everyone.
And one final message, I got a telephone call while we were off on the side there. The first responders and the coroner's office has asked that if they get called out to a home, they would request that the family members, for their safety and the safety of the first responders, to please step aside and allow them to do their job and give them distance so that they don't become infected or the family members don't become infected. That's the first responders and the coroner's office has asked to please step aside and let them do their jobs for everyone's safety. St. Landry Parish government is open. Most of the offices are being run by telephone. If you need to reach out to the government, you can dial one of the numbers for the offices and someone will be there to help you. St. Landry Parish would like to thank the healthcare professionals who are on the front line, the media who are on the front line, and again, we'd like to thank all of those who are following the stay-at-home order and the curfews and encourage everyone to pay attention to those. That's it. Thank you all very much for coming.
Lane,
Yes.
have you all heard anything about the National Guard that was supposed to be in the parish this week to help with the lunchroom?
The National Guard did contact me about providing some personal protection equipment for the lunch ladies.
Right.
I have not heard back from them at this point. Anybody have any questions for anybody else here today? Okay. Thank you all.
Thank you.